The idea of simulation really percolated through the medical school and through the School of Nursing about 2 years ago. And we've had multiple conversations because we all agree that simulation is a very important component of health education. The purpose of simulation is to give students an opportunity to rehearse skills, to learn about teamwork, to learn about roles, to learn about collaboration in a safe environment.
So there's 3 pieces to the project today, and each student will be here for about an hour and a half. The first one is the simulation itself, and basically the students are brought into a room. They're given the basics of the case, and then they're just turned loose to care for the patient. Following that, they each get a flash drive that has a tape, if you will, of what their performance was. So it's just a verbatim videotape that they watch themselves, and then after that there's a 30-minute debriefing with one of our faculty. The debriefing is to get people to focus on, rather than the medical aspects for this particular case, the interactions that they had, how the group functioned together, and to give them some ideas for, as they move forward in their careers, how they can be more effective as a member of a care team.
We have nurses and medical students, and we expect people, when they get to the clinical setting, to understand how to work together. But we don't necessarily provide those opportunities in an educational environment.
We're starting to introduce people into working together as members of care teams, and in some ways we're breaking down traditional role barriers that have existed in healthcare before, and encouraging collaboration rather than ownership of different activities.
We hope they'll learn how to respect other people's contributions to healthcare. And we hope that we give them an opportunity to practice what worries them most, whatever that might be, and it's different from student to student, in a safe environment before they go into the clinical setting and start interacting with patients and families. Healthcare is growing increasingly complex. Patients are sicker. Technology is ever-changing. Therapies, interventions are always improving and evolving. And in order to assure that patients receive effective, safe care, all members of the team have to be communicating and collaborating. If it doesn't happen, then we know that patients do not receive the best care possible. There is ample evidence that collaboration and communication contribute to safe and high-quality care.